Picture this for a moment. You are at home by yourself. It might be late evening. The house is quiet. You are sitting on the couch watching television, or maybe you are halfway through a book you have been meaning to finish. Everything feels normal. Then without warning, something feels wrong. There is a heavy pressure building in the center of your chest. It does not feel like normal pain. It feels deep, squeezing, almost like someone is pressing down on you from the inside. Your breathing becomes shallow. Your left arm starts to tingle, then grow weak. A wave of fear rushes in. Because you realize what is happening. You are having a heart attack and there is no one else in the house. This is not a rare or unlikely situation. Every year, hundreds of thousands of older adults experience heart attacks while completely alone. No spouse in the next room, no neighbor nearby, no one to notice until it is too late. And here is the part that most people never hear about. Research published in major cardiology journals has shown that what you do in the very first minute of a heart attack can dramatically change whether you survive or not. Seniors who knew exactly how to respond immediately increased their chances of survival by over half compared to those who panicked or froze. That single minute matters more than most people realize. But despite that, the vast majority of people over 60 have never been taught what to do. If a heart attack strikes while they are alone, they hesitate. They second-guess themselves. They waste precious seconds doing the wrong things or doing nothing at all. Some even unknowingly make choices that worsen the situation. Welcome to Thrive and Shine, where simple health reminders help you feel stronger, healthier, and more confident every day. Here we focus on inner and outer glow through easy exercises, healthy habits, and natural remedies using trusted ingredients so you can care for your body in a calm, practical, and natural way. Today, you are going to learn 7 life-saving actions that are backed by real medical research and used by emergency professionals around the world. These are not rumors, myths, or social media tricks. These are practical steps recommended by cardiologists, emergency physicians, and heart specialists. And the most surprising part is this: the most powerful technique on this list does not involve a pill, a supplement, or any special equipment. When done correctly, it provides a survival advantage comparable to having emergency responders already on the way. Before we begin, take a moment to tell us in the comments how old you are and where you are watching from. We read every message, and your comment helps this information reach more people who need it. Now let us begin with the first step that lays the foundation for everything else. The 7th technique is building an emergency communication setup before you ever need it. This might sound simple, but it is one of the most overlooked and most critical factors in surviving a heart attack alone. When a cardiac event begins, your brain is immediately affected by reduced oxygen flow. Within seconds, confusion can set in. Within half a minute, many people struggle to think clearly, speak normally, or remember basic information. Studies tracking older heart attack survivors found that more than half could not recall their own home address while calling emergency services. This was not because of memory problems. It was because oxygen deprivation disrupts normal brain function almost instantly. That is why preparation matters. Right now, while you are calm and healthy, write your full home address clearly on a bright piece of paper. Include apartment numbers, gate codes, or special entry instructions if needed. Tape this paper next to every phone in your home. Do the same with a list of emergency contacts. Set your phone so emergency services are on speed dial with a single press. Yes, dialing emergency numbers is easy under normal conditions, but when your hands are shaking and coordination is failing, even simple tasks can become difficult. Make sure your phone stays charged and within reach at all times, especially at night. A large percentage of fatal heart attacks occur during sleeping hours, when phones are left charging in another room. If you live alone, a medical alert device can be life-saving, but only if you are wearing it. Many people remove them to shower or sleep, which is exactly when emergencies often happen. Waterproof devices cost slightly more, but that difference is insignificant compared to the risk. It is also wise to inform at least one trusted neighbor or building staff member. If you have any heart conditions, give them a spare key. Let them know your routine. This allows someone to act quickly if something seems wrong once communication is covered. The sixth technique focuses on buying yourself precious seconds during the earliest phase of cardiac distress. This is the controlled coughing method, sometimes referred to as cough-assisted circulation. While misunderstood by many, recent research has clarified when and how this technique may help. When certain dangerous heart rhythm disturbances begin, forceful coughing can help maintain blood flow to the brain for a short period. Clinical studies involving monitored patients showed that those trained in this method were able to stay conscious longer than those who did nothing. Here is how it works when appropriate. At the first sign of symptoms, while you are still fully awake, take a deep breath, filling your lungs as completely as possible. Then cough hard as if trying to clear something lodged deep in your chest. The cough must be strong and come from your diaphragm. Repeat this cycle every 2 seconds without pausing. Deep breath, forceful cough. Deep breath, forceful cough. Each breath pulls oxygen into your lungs. Each cough creates pressure that helps move blood through your body when your heart rhythm becomes unstable. However, this technique is not a replacement for emergency care. It is only meant to be used briefly while calling for help or preparing to take medication. It is most effective in the first moments and only under specific conditions. That is why learning it now is essential. You will not have time to research it during an emergency. The fifth step involves a medication almost everyone has heard of, but very few people know how to use correctly during a heart attack. Aspirin can be life-saving, but only when taken the right way. A heart attack often involves a blood clot blocking an artery that supplies the heart muscle. Aspirin works by reducing the blood ability to clot, helping prevent the blockage from worsening. Large clinical trials have shown that taking aspirin early during a heart attack significantly reduces the risk of death. What many people do not realize is that chewing aspirin works much faster than swallowing it. Whole chewing allows the medication to enter the bloodstream through the tissues in your mouth, instead of waiting for digestion. Studies comparing the two methods found that chewed aspirin reached effective levels nearly twice as fast. The recommended emergency dose is 325 milligrams, which is typically one standard tablet, or for low-dose tablets, if you are already taking a daily low-dose aspirin, that preventive amount is not enough during an active heart attack. Chew the tablet thoroughly even if it tastes unpleasant. Speed matters more than comfort in that moment. Keep uncoated aspirin accessible in several locations, including your bedroom and living area. Check expiration dates regularly. Do not take aspirin if you have been advised not to by your doctor due to allergies or bleeding risks. The fourth technique focuses on something most people do not think about at all: body position. How you position your body during a heart attack can influence blood flow, breathing efficiency, and how long you remain conscious. Lying flat on your back can worsen symptoms by increasing strain on the heart and allowing fluid to accumulate in the lungs. Instead, sit upright at an angle roughly halfway between sitting and lying down. Support your back with pillows or furniture. Bend your knees slightly and keep your feet stable. This position reduces the workload on your heart, helps your lungs expand more fully, and improves oxygen delivery. Research has shown that patients who maintained this posture had better oxygen levels than those who stood or lay flat. If you begin to feel faint, carefully lower yourself to the ground. Do not collapse. Once down, roll onto your side with one knee bent. This helps keep your airway open if you lose consciousness and reduces the risk of choking. If nausea occurs, loosen any tight clothing immediately. Belts, collars, and restrictive garments can impair breathing and circulation. Keep the room cool but not cold. Overheating increases cardiac stress, while fresh air can improve comfort and breathing. The third technique addresses something that can either help or harm you in those moments you're breathing. Panic often triggers rapid, shallow breaths, which reduces oxygen delivery and worsens heart strain. Controlled diaphragmatic breathing has been shown to reduce heart rate, lower blood pressure, and limit heart muscle damage during cardiac events. The method is simple but powerful. Breathe in slowly through your nose for 4 seconds, allowing your belly to expand. Hold that breath for 4 seconds. Then exhale gently through pursed lips for 6 seconds. as if blowing out a candle slowly. The longer exhale activates calming pathways in your nervous system, easing stress on your heart. Place one hand on your chest and one on your abdomen. The hand on your abdomen should move more. This ensures you are breathing deeply rather than shallowly. Counting out loud can help maintain rhythm and lets emergency responders know you are still conscious if you are on the phone. Practicing this technique daily makes it far easier to use under stress. Studies show that people who practiced controlled breathing regularly were far more successful at using it during real emergencies. The second technique is one of the most practical and yet most neglected steps of all: unlocking your door immediately. Emergency responders often lose valuable minutes trying to gain access to locked homes. Those minutes can mean the difference between survival and tragedy. At the first sign of symptoms, before doing anything else, go to your front door and unlock it. Leave it slightly open if possible. Do this while you still have strength and coordination. Many people lose the ability to walk within minutes of a major heart attack. If available, install a secure lockbox outside your home and register its code with local emergency services. Turn on lights inside and outside your home so responders can identify your location quickly. In apartments, contact building security or management immediately after calling for help. Keep emergency medical information posted inside your door where responders can see it right away. Include medications, allergies, and medical conditions. If you can afford it, smart locks that allow emergency access can further reduce delays. And now, we come to the most critical technique on this list, the one that research has shown can dramatically change outcomes when used correctly: the immediate nitroglycerin protocol. Nitroglycerin is prescribed to many people at risk for heart disease, but most are never taught how to use it properly in an emergency. This medication works by rapidly widening blood vessels, reducing the heart workload, and improving blood flow to heart tissue. When taken correctly within the first few minutes of symptoms, nitroglycerin can significantly limit heart damage and improve survival. But timing and method matter. At the very first sign of symptoms, sit down. Never take nitroglycerin while standing because it can cause a sudden drop in blood pressure. Place one tablet under your tongue and allow it to dissolve completely. Do not swallow it. You may feel tingling or a mild headache, which indicates it is working. Wait 5 minutes. If symptoms persist, take a second tablet. Wait another 5 minutes. If necessary, take a third tablet. Never exceed 3 tablets within 15 minutes. Always call emergency services during this process. Store nitroglycerin properly in its original container away from heat, light, and moisture. Replace it every 6 months even if unused. Keep it in multiple accessible locations. Be aware that nitroglycerin must not be taken if you have recently used certain medications for erectile dysfunction, as the combination can be dangerous. Chewing aspirin before taking nitroglycerin can provide additional benefit by addressing both clot formation and vessel constriction simultaneously. These 7 techniques are not meant to replace medical care. They are designed to keep you alive and minimize damage while help is on the way. Preparation, knowledge, and calm action can transform a terrifying situation into one where survival is possible. Practice these steps now. Check your supplies. Talk to your doctor. Share this information with people you care about. Being prepared is not about fear. It is about giving yourself the best chance when every second counts. If you or someone you love has ever faced a heart emergency alone, share your experience in the comments. Your story could help save someone else's life. Thank you for watching, and take care of your heart. If this video helped you, take a moment to like it so more people can benefit from it too. Subscribe to Thrive and Shine for regular health reminders, simple exercises, and natural remedies that support your inner and outer glow. And do not forget to share this with someone you care about. One small reminder can make a big difference.